Hello! So we are a little behind schedule, and I don't want to rush us through important concepts. It's really important to me that you have a quality experience in the classroom that includes the opportunity to interact with each other and discuss concepts we are learning about. Therefore, this mini lesson will focus on the remaining few concepts for Chapter 2 by outlining postpartum factors that affect the newborn. Remember, we will not review this lesson in class, nor will the information be retaught. However, you are always welcome to ask questions and seek one-on-one assistance from me. Okay. We mentioned during our last class that the age of viability means survival is possible, not guaranteed. This is where low birth weight comes in. The World Health Organization has set forth different classifications based on weight. So refer to page 78. Low birth weight is classified as less than 5.5 pounds. Very low birth weight is classified as under 3 pounds and 5 ounces. Extremely low birth weight is under 2 pounds and 3 ounces. The baby normally doubles its weight in the last 3 months of a full-term pregnancy, with about 2 pounds of that weight gain taking place during the final 3 weeks. Let's focus on some other terms that are related to low birth weight. Preterm means a baby is born 3 or more weeks early. We no longer use the term premature. Additionally, some babies can be small for gestational age, SGA, which means they gained weight slowly throughout the pregnancy. Now, can a baby have low birth weight and be SGA, small for gestational age? Yes. So what are some factors associated with low birth weight? Obviously, the teratogens we mentioned in class are a factor, as well as the prenatal environment itself. This is why good prenatal care is so important. The mother's health is also key. She needs proper nutrition, but not all women are fortunate enough to have access to the food they need, which is where food insecurity comes into play. See page 81. ART refers to assisted reproductive therapy, which sometimes results in multiple births and low birth weight. Essentially, the mother's entire social network is a factor in prenatal health. Anything that stresses the mother also has an impact on the unborn baby. We know that education and social support are protective of prenatal health, but risks are apparent in every moment of conception, pregnancy, and birth. It's awareness of these risks that helps enable parents to set priorities and act on them, and it directs health professionals in how to best advise pregnant women. Is low birth weight a big deal? Yes, absolutely. Early death is the biggest hazard. Within months, cognitive, visual, and hearing impairments may show up or emerge. On page 80, check out what longitudinal research has shown us about long-term effects. But in all this, we are back to risk analysis, possibilities but not certainties. When compared to other nations, the United States has a low birth weight rate of 8%. So what can we do? Kangaroo care on page 69 and infant massage can help. Babies show increased weight gain, discharge from the hospital 3 to 6 days earlier, and enjoy both emotional and physical benefits. Check D2L for Lori Wade's handout on infant massage, and there's also a video on swaddling. Nature and nurture are revisited as we close this chapter. We are all well aware that new mothers experience a great deal of physical pain both during birth and the postpartum period. However, psychological pain can be worse and it can be lethal. So grab your Jeopardy list as we will complete your last item together. Which one of these is more serious? Baby blues or postpartum depression? If you said postpartum depression, you are correct. About 70% of new moms experience baby blues. No treatment is required, as the problem is usually resolved within 1 to 2 weeks on its own. However, postpartum depression affects between 8 to 15% of new moms, with an average of about 10%. The reason the numbers vary so greatly is because oftentimes new mothers do not speak up about having PPD or seek treatment. Maternal depression can have a long-term impact on the child, which is just one reason we should quickly recognize the signs and treat it. PPD is marked by excessive sadness and also persists longer than 2 weeks. Can dads have postpartum depression? Yes. Research is beginning to indicate that the best thing we can do for new moms suffering from PPD is to engage them in psychotherapy, give them a chance to talk. Support groups are also tremendously helpful. Additionally, we know that if a woman has had prior depressive episodes, she is more likely to develop PPD. We are learning more about it every day and researching new ways to help mothers who suffer from it. What we know is that connections matter. Being understood and heard matters. So this concludes Chapter 2, and we are now ready to move on to Chapter 3 in class. If you find that you need help with anything in this chapter or Chapter 1, check out the study resources you have consistently available to you. I'm always here to help, in addition to Sarah Lethko, our resident psychology tutor. So just let me know if you need help.